To best help your hips, you must understand the deep muscles under the glutes that hold your hip socket in place. The piriformis connects to the anterior sacrum and sacral ligament to the greater trochanter of the femur. The obturator externus connects from the obturator foramen to the trochanteric fossa of the femur. The remaining deep muscles are the gemellus superior, obturator internus, gemellus inferior, and quadratus femoris. We're going to begin with a stretch of the piriformis. Start seated in a chair and place one foot on top of the opposite knee. To create the stretch, pull the hips forward as if pushing your belly button through the hole between your legs. In this stretch, press your foot down into the knee for 5 seconds. 3, 2, 1. Relax and pick up the slack for about 10 seconds. 8, 7. Again, you're relaxing the belly button through the knees. 4, 2, 1. Press the foot into the leg for 5, 4, 3, 2, 1. And pick up the slack, relaxing forward. 8, 7, 3, 2, 1. Repeat this process for a total of 10 contractions. Now, in the same figure 4 position, use a lacrosse ball to increase the intensity. Place it right at the head of the femur where the piriformis inserts. You may have to roll around a little bit to find the tender spot. Once you find it, repeat the 5-second contract and 10-second relax sequence for a total of 10 repetitions. Next, we're going to work the glute maximus. The glute muscle starts at the posterior sacrum, ilium, and posterior gluteal line of the ilium, all the way down the gluteal tuberosity of the femur, iliotibial tract attaching to the lateral condyle of the tibia. When the glutes are not working correctly, the attachments at the knee take the brunt of the pain. We're going to begin the work on the glutes by simply sitting on the foam roller and rolling back and forth. If you feel like you're not getting enough pressure, you can lean to one side, either with your arm on the ground or your arm on the foam roller. Remember to work the glutes with different leg positions. You can roll them in or let them drop out while you continue to roll back and forth over that tissue, looking for the most tender and sore spots. When you find one, sit and hold. After some deep breaths, move on. Continue to find the most tender spots on the left and right sides. If it feels like you didn't get enough pressure, move on to the lacrosse ball. Place the lacrosse ball under the glute muscle. Side note, to take some pressure off the wrists, simply use your foam roller as an armrest under your elbows. Begin rolling the ball around the glute muscle till you find a tender spot. Pause and breathe. Remember to take deep breaths through the diaphragm. Each time you breathe out, relax more into the lacrosse ball. Next, we're going to focus on the glute medius, minimus, and the tensor fascia lata. The glute medius connects from the iliac crest of the ilium between the posterior and anterior gluteal lines out to the greater trochanter of the femur. Beneath the gluteus medius is the gluteus minimus. This muscle begins from the ilium between the anterior and inferior gluteal lines to the anterior surface of the greater trochanter of the femur. These two muscles work together to steady the pelvis during ipsilateral training, or standing on one leg. The tensor fascia lata begins from the iliac crest posterior to anterior superior iliac spine, all the way down to the iliotibial tract, which you can see is the lateral condyle of the tibia. Much like the glute max, when these muscles are not firing, the pressure goes directly into your knees. Laying on your back with a straight leg and your opposite knee bent, place the lacrosse ball next to your hip. Do not lift the hips to place the ball, simply relax on the floor, place the ball beside your hip, now roll over onto the ball. You may have to move the ball around a little bit to find the right spots, but ultimately you are looking for the pain to settle into the lacrosse ball. You may begin by rolling the knee in and out or pressing down into the floor and lifting the leg just a tiny bit. This position is uncomfortable. Stay here until you feel those muscles relax and you can allow your pressure to lay on the lacrosse ball.